So here's to being super consistent. It's a Sunday, I'm in the clinic. I've just finished doing our new health and safety assessments for the post-COVID situation, just making sure that we are staying up to date with our procedures and making sure that we keep our environment super safe for you guys here in the clinic. However, what I wanted to just do is just jump on and have a quick conversation about something that I find super important as a chiropractor, which is what are we focusing on when we actually go through chiropractic care, and what is it about chiropractic care that we should really be focusing on? And that's the most important organ that we have in our body. Now, for most people, when I ask this question, I go, okay, which one of your organs is the most important organ in your body? The majority of people that I ask that question to will naturally start to go through the organs, and they go, okay, is it the heart? Is it the lungs? Is it, because these organs are essentially what people would think will keep us alive, which in part is true. If our heart stops, we will no longer stay alive. And if our lungs stop, we will no longer stay alive. But there's one organ in our body that pretty much controls all of these other systems. And it's our brain and our central nervous system. And our central nervous system is essentially a continuation of the neurons that are sitting in our brain. Now, the thing is if our brain and our neurons or our central nervous system are not working properly, it doesn't really matter how healthy all of our other organs and systems are, because the brain and the central nerve system are going to be the things that actually keep those things in check. So if you've got an unhealthy brain or nerve system, then all of a sudden these systems are not going to work the same. Haley, I absolutely love that comment. Cherry jam available from Wednesday. By the way, I've tried some of Haley's jams and they're absolutely awesome. So the brain and the nerve system are pretty much the most important thing. Now, what we know is, and you'll hear me talk about these topics a lot, is that our brain and our nerve system, our brain and nerve system control all these other organs. But when we get interference with our brain and our nerve system, then obviously some of the other organs can start to be affected as well. So one of the primary examples, and I unfortunately had to witness a case of this month, is cauda syndrome, which is where we have damage in our lower back that starts to cause compression on the nerve roots from our lower back, which can start to have an impact not only on the nerves going into our legs, which can make our muscles in our legs go weak. It can make our sensation in our legs increase or decrease, but it actually also affects people's bowel and bladder function. So I had a gentleman this month who came in, who'd seen his doctor, came in with low back problems, which he got after about 2 to 3 minutes of walking, would only leave when he sat down, but he had problems going to the toilet. So the thing is this was not an issue with his bowels or his bladder. This was an issue with his spinal nerves. His spinal nerves had been so greatly damaged that now those nerves that are going to his organs were no longer working properly. And as a result, he was potentially, if we didn't get it corrected soon enough, going to lose those functions. So the most important thing in making sure that the brain and the central nerve system works properly is making sure that the spinal column is working properly. Because where is the brain and nerve system housed? Well, it's inside of the spine. So this is sometimes why when we see patients with neck and back pain, they will see other things start to improve. Lung capacity, breathing, headaches, digestive issues. All of these things could be affected by the spinal nerves and the brain. So if the spinal nerves and the brain are not working properly, all of a sudden these systems can start to change, and that can start to have an effect. Now, when we start getting our patients' spine working properly, sometimes those nerves will start to improve, and as those nerves start to heal, so will those people's functions. So a lot of the time we'll see improved digestion, sleep, etc. So one thing that's always worth noting is that when you are talking to your chiropractor, that all symptoms are actually worth discussing, because a lot of the time people will only think about the pain and the joints, and not necessarily all of these other systems that are going on, but a lot of the time your chiropractor may well be able to advise you on how you can improve on those things through affecting the nerve system or your diet, your lifestyle, in order to actually improve things there as well. Guys, enjoy your Sunday. I know it's a bit windy outside, but it's actually still a beautiful day. Me and a friend have just gone and done a bike ride over the top of BG Head. It was a bit blowy, but actually it was a really, really, really nice cycle ride up there. So go out, enjoy the sun, enjoy your day off. And sleep, what's that? Yeah, a lot of us probably at the moment aren't getting the same levels of sleep that we were before because of the stress. But if you need anything, obviously you can reach out to us. You can jump on, send us a Facebook message. Equally, you can just send us an email. Also, we've got tons of other content that's available. We are on Spotify and iTunes. Our Spotify and iTunes podcast is called Coffee with the Chiropractor, and that is with me and a multitude of different practitioners around the country. And actually, we've even gone as far as the States as well so far. Guys, that's all I've got time for today. If you guys have got any further queries, please do not hesitate to get in touch. And I look forward to seeing you all in the clinic very, very soon.